Your health insurance could refuse to pay for your cancer screening.
The U.S. spends more on healthcare than almost any other country and has the worst health outcomes.
Yet millions of Americans spend $500 a month on health insurance.
Lower life expectancy and the number of people with chronic conditions.
So if it's not helping us, where is the $4.5 trillion we spend on healthcare going? It's not being spent to cure the incurable or to build expensive medical equipment or even to face the deadly nurse shortages we're facing. After days of research, I realized that this unethical and fatal system comes down to one thing: greed. But they've made the system so complicated that it took me over 20 hours to find and understand the reality. But I don't gatekeep information, so I'm gonna explain how healthcare works in the US so you can understand who truly profits from all this. The US government outsources a lot of goods and services to private companies. This creates a competitive market because if businesses don't provide a good value, then consumers don't buy from them. This works out great for like a candy bar, but when an entire industry's goal is to make money off of people's illnesses, then profit becomes more important than people. Here's how it works in other countries. The government goes to different hospitals and negotiates how much XYZ will cost for its people. They give the hospitals a lot of customers, and in return, the hospital gives them a lot of discounts, like bulk deals at Costco. In the US, over 1,000 insurance companies are in charge of that instead. Now that sounds great in theory. We get lower prices, hospitals get more money to help people, and insurance companies are just these saints that want to help people. All's well that ends well. That would be great, but in this universe, they need profit. $41 billion. That is how much America's largest health insurers made in a year. That is $10 billion more than Netflix made in revenue that same year. This money comes from discounts from hospitals, complex and tricky policies, and outright just refusing to pay for services. They literally spend millions of dollars to not pay consumers for care they thought they were insured for. They call it utilization review, aka figuring out if a service is covered under a given plan. And shocker, they keep their denial rates a bigger secret than Disney keeps Walt Disney's head. A victim of this greed was a woman that collapsed with a rare heart condition and ended up needing an emergency heart transplant. She had her emergency heart transplant done in a hospital in her health plan's network. But here's the thing. No one bothered to tell her that her transplant surgeon didn't take her insurance. So they billed her $70,000 and sent lawyers and collection agencies after her while she was at home recovering. So while the system might seem amazing on the surface, it leads to crap like 3 people at the same hospital paying outrageously different prices based on what insurance they can afford. This happens because different insurance companies negotiate different prices. And let's remember that they're profit-driven entities, so their main goal may be to increase their profit instead of prioritizing affordable healthcare. This tends to mean higher premiums, copays, or out-of-pocket costs for patients. It can also limit access to certain medications if the insurance company doesn't cover them or if they're too expensive. Americans are literally splitting pills or just not taking them because of the cost. That shouldn't be a normal thing in a country like this. A good part of the cost honestly stems from making the system as complicated as possible. Us, the consumers, have to choose between different tiers of coverage like high deductible plans, managed care plans, or fee-for-service systems. I honestly don't really know what I just said, but that's partially why the US spends so much on healthcare. There are so many unnecessary parts to this that insurance companies spend 15% of $4.5 trillion to pay people to understand and deal with all this crap. And that brings us to where an unbelievable part of our money is going: the middlemen. More than $300 billion went to middlemen in 1 year. That is $85 billion more than the NFL has made in a decade. Middlemen include group purchasing organizations, distributors, and pharmacy benefit managers. But we're gonna focus on pharmacy benefit managers because after what I've learned, we have beef with them. I'd never even heard of them before this, but they play a pretty important role, or so they claim.
They do this by negotiating with pharmaceutical companies for rebates. For many of the drugs a pharmaceutical company sells, it pays a rebate to the PBM. The PBM sometimes pockets a portion of the rebate and passes another portion on to the insurance company or employer. Why the pharmaceutical company pays these rebates? The drug company gets moved up on something called a formulary. It's the list of drugs that the insurance company covers, and it's grouped in tiers. Each tier represents what portion of the list price the patient pays and what portion of the list price the insurance company pays.
They got $350 billion in discounts in 2021, which is awesome. People get the life-saving medication they need for less money. Apparently, an increase in discounts for insurance companies doesn't necessarily mean a decrease in consumer prices. A really shitty example of this was insulin prices and costs, specifically a really well-known brand, Lantus. In the same time period where PBMs got better discounts, out-of-pocket costs for patients with health insurance who use Lantus went up by 60%. Insulin, that thing that diabetics need so they don't die from hypoglycemia within a couple days. A possible reason for this is a really evil thing called price spreading. What's that? Let me tell you. Price spreading is when PBMs charge insurance companies more money for drugs compared to what they paid the drug manufacturer. They essentially make money from selling drugs at a higher price to insurers than they paid for them with the drug manufacturers. Yes, they obviously pocket the difference. And I'm not just talking about a little 5 to 10% on the side. I'm talking 40% of gross profit. That is insane. And considering we're talking about drugs people need to survive, it's downright unethical. But even when the health insurance members do get a cheaper price, people paying out of pocket suffer. Drug prices go up about $39 on average as these rebates increase. At least people with health insurance get a win this time. But not everyone in the health insurance company is immoral. And quite frankly, healthcare physicians can be victims of this messed up system as well. But they can also abuse it. About 10% of $4.5 trillion goes to physicians themselves. Another 5% goes to nurses, and 15% goes to administrative waste. So that, combined with the 15% from the insurers, is about 30%. 30% of all US healthcare spending gone from administrative waste. Now go tell your grandma why she can't afford that hip replacement. Thankfully, physicians are paid more than in other countries, but there is a moral gray area because they're paid for service, also known as the fee-for-service model. So if you come in for a tummy ache, they get more money by running more tests that, shocker, you still have to pay for. Another thing is doctors could get certain legal benefits from prescribing medication from certain drug manufacturers. Now, not all physicians are the devil. In fact, I'd argue that the people that were only in it for the money definitely got weeded out in the decade-long process. So while yes, some doctors do prescribe unnecessary treatments or tests, it's out of fear of not covering all the bases. And that's called defensive medicine. And that accounts for almost 3% of national healthcare spending. I mean, who could blame them? Almost 77% of US surgeons have gotten sued. And they literally went to school for so long just for their treatment plan to get denied by some money-hungry insurance company. So they have to come up with plans that fit their patient's health insurance, even if that's not necessarily the best treatment plan. On top of that, some services require pre-authorization, so they have to fill out the paperwork, go through all the hoops just for it to possibly get denied. It just sounds so frustrating and tedious. Naomi, this is insane. Middlemen, profit-driven healthcare, complicated systems. Why doesn't the government just make it stop? Good question, my friend. That is because they just quite frankly can't agree on how. Some people obviously have the mentality of the market will take care of itself, but considering that's not working very well for healthcare, what does the government do to stop this? In countries with government-managed healthcare, the government negotiates directly with hospitals to get lower prices on medication. They use their buying power to help negotiate bulk deals, which keeps healthcare costs low for everyone. On top of that, they regulate drug prices so they remain affordable for patients. It's not a perfect system though, because all the bureaucracy means that drugs are often slower to hit the market.
When there's a committee that determines whether a new drug is worthwhile, sometimes they say no. And when they negotiate the price, sometimes they don't come to an agreement and hit a standoff. Both systems require trade-offs. Regulated drug markets tend to make drugs more affordable, but some drugs are completely unavailable. And while the US has more drugs technically available, they're often too expensive to actually afford.
That is one approach that the US government has taken with Medicare. They have a lot of customers, so they negotiate much lower prices than private insurance companies. Another way they've tried to stop this is by increasing price transparency. Now, hospitals and insurance companies legally have to tell the public the prices they've negotiated for services, treatments, drugs, stuff like that. In theory, this allows patients to shop around and pick the best prices. The goal was to kind of force insurance companies to lower their prices, or else they wouldn't get customers. The problem is people don't tend to choose health insurance companies like they're choosing a vacation spot. Sometimes their insurance coverage is all they can afford or all their company offers. So I personally don't think it's the best choice. It is a step in the right direction though. They've also thankfully lowered some drug prices like insulin, which is now capped at $35 a month, only for Medicare patients though. The last thing I'm gonna bring up is very important and possibly life-saving. You can now afford to call an ambulance if you have insurance. Is it still gonna cost money? Yes, unfortunately. But under the No Surprises Act, you cannot be charged an out-of-network price for emergencies. And you can't be charged an out-of-network price if you're being treated by an out-of-network provider in an in-network facility. It's still not great, but again, a step in the right direction. To sum it up, a lot of America's healthcare spending is going towards unnecessary and profit-driven companies. I just feel like something as serious as medical treatments shouldn't be for profit, because then we just all get turned into numbers. The kid with cancer, the dying grandma, the teen with the chronic illness, it all just becomes a couple extra billion to them, you know? I don't know, it just feels really icky and weird, and I wish there was a perfect solution. I'd personally put that health insurance money into well-managed taxes and not have to worry about calling an ambulance. I know a lot of people don't want to cover the cost of other people's healthcare, but guess what? Insurance companies will just raise your premium if they're not making enough profit. They're not paying for our healthcare. People like you and me are. They just find ways to make profit off of it, so you're covering someone else anyway. We are really fortunate though to be living in a country where healthcare is this good. Yes, it's not close to perfect, but it is so much better than millions of people have.
Thousands of people waiting in line for hours to see a doctor.
This is the first time we have seen such a thing, and we see how helpless we are.
There are millions of people who live out of the reach of healthcare. They will die from malaria, pneumonia, conditions we know how to treat.
With all the information you've just learned, how do you think we should solve this? Is the solution voting, writing through our Congress members, or picking cheaper insurance companies to promote a competitive market? Let me know what you think. I really hope to see you next week, and have a blessed day.